So thank you for joining me and carving out time for this as a working health professional, somebody higher in the chain. I know you're very, very busy, and NBC and our listeners very much appreciate your time. I'm going to let you introduce yourself, if that's okay.
Hey, well, good afternoon to you and your listeners, Brandon, and thank you very much. I appreciate the privilege of being able to join you and your listeners this afternoon. My name is Dr. Khaketla, and I'm the medical health officer who covers the far north area of our province. So in that role, I'm a specialist public health physician who is responsible for the protection and promotion of the health of northern populations. And I work with my team here at the Northern Population Health Unit in La Ronge. So a lot of people don't know what we do, and we deal with a lot of different issues that affect northern communities. But as you know, right now, our big focus of the work is the response to the COVID-19 pandemic. So I'm glad our conversation is very timely. Thank you.
No problem. Thank you for the introductions, Dr. Khaketla. So today, while I have you, we're going to talk about two broad categories. The first category is kind of the current state of COVID-19 in the far north regions of our province. And the second large category is just vaccinations and how that's going. So dipping into the first of those two categories, that is the current state. On Wednesday, January 13th, Saskatchewan, I said that like I don't live here, have the highest per capita in the country with 319 cases per 100,000. Now this whacks and wanes and changes, but it's something to note that we did take that title this week. And then over the weekend, the January 8th to 11th, a lot of far north communities saw a change from more regular daily numbers for their communities to the weekly kind of data, and in part due to the contact tracing load that's been put on northern Saskatchewan. So watching social media, there's been a little bit of kickback where people feel that they're pacified by this data and they would like to see these daily numbers. But I just want to talk a little bit today about why daily data really shouldn't affect our behavior, and about a little bit about what case investigation looks like in the north.
Okay, thank you. That's a really good way to start off, Brandon. So, as you rightly provided that initial context, we are in the middle of the second wave here, and that is the same for us here in the north. The situation right now is that we're experiencing an increase in the number of our reported active cases. We're seeing an increase in our hospitalizations, and we're also seeing an increase in outbreaks of COVID-19. So certainly overall increasing activity, and this is right across the far north. Various communities in the north are affected, at different degrees. Some are experiencing a higher level of activity than others, but we've really seen the spread of disease right across, and this is, across jurisdictions, both on and off reserve, and that includes all the way up into the Athabasca. So right now, if you look at our provincial map, and this information is publicly available, as of the update as of the 14th of January was that there are over 700 active cases currently being followed up by our teams right across the north right now. And, since the beginning of the pandemic, we've had, about 2,450 total cases reported across the north. And so if you look at, how small our population is, that's quite a significant proportion of the entire reported cases within the province of Saskatchewan. And so, I want to emphasize that right now this is a critical time for us in the north. We are anticipating that we're going to be seeing further increases in these numbers. And now is the time for us to really step up and make sure that we're all doing our part to stop the spread of COVID-19 in northern communities. And we actually know what to do because we know what works. We've seen these measures that are being put into place, and we've seen them decrease the numbers of active cases, not just in our province, but in other, or our country, but in other jurisdictions as well that have had more success in mitigating this COVID-19 pandemic. A good example is that of the country of New Zealand, and there are others as well. And so these are things like, going back to the basics, staying home if you're sick and getting tested, avoiding gatherings, avoiding non-essential travel, physically distancing, hand washing frequently, all of these things that we've been talking about from a public health perspective, and any other recommendations that we're hearing about. And these are important not just to protect ourselves individually, but to protect others around us who are, more vulnerable, including our very elderly population. Thanks, Brandon.
Mm-hmm. So, with this movement to weekly data, obviously that communicates a difficulty on the behalf of the contact tracers and the people doing these case investigations. And in mid-December, the provincial government said they were hoping to get about 6,000 daily work hours from contact tracers. So that'd be about 750 full-time workers every day doing this 8 hours a day. So what does that mean for Northern Saskatchewan, or how has this process of contact tracing been going? Are we able to put this into a frame of reference, the 6,000 hours, in terms of what are we seeing for an easy case investigation, or what might be a more difficult one where somebody has gone out and interacted with more people on New Year's, say, or I'm just wondering if we can, 6,000 is a big number. So can you help our listeners understand what the range is in investigating these cases and why there is such a backlog or difficulty?
Great, thanks, Brandon. I really like this question because it's important, one, for us to understand how transmission is happening within the North, the impacts of these large-scale contact tracing, and in terms of capacity, but also in terms of spread within the northern context. So, obviously I can't speak to kind of the planning that's occurring at a more provincial level, but I can certainly provide specific context because this is the work that we're doing across the North on a day-to-day basis. So the first thing that I wanted to highlight is how we're seeing spread within our northern communities. So the main ways are, firstly, we're seeing close contacts within very large households. And this is how then one person tests positive, and then you get subsequent transmission because people are not able to safely isolate from each other. And then you see these large households with additional cases testing positive. So that's one way. The second way is that we're still seeing people socializing outside of their own individual households and between households. We're still seeing people getting together, to party and to interact with each other outside of their households. And we actually saw this quite a bit, evidence of this happening over the Christmas holidays as well as New Year's. And so then people developing symptoms afterwards and then testing positive. So that's a huge risk factor that we're seeing in the North. And then the third one is related to travel outside the North, but also between northern communities. And so, as you know, there's currently a travel advisory that we issued as medical health officers in the North that advises against non-essential travel outside of the North and outside of your communities. And there's a reason why that is, because we were seeing this type of travel, people going down south, getting exposed, and then coming back into the communities, and then spreading, and then further spread happening that way. The other main way that we've seen transmission happen is when people have attended gatherings, for example, such as funerals and wakes, and then subsequently people getting sick, and then by the time they're back in their homes and workplaces, and then spread can happen that way. And then, in addition to this, sometimes people are experiencing challenges with homelessness and alcohol and substance use challenges. And these things make it very difficult for people who are already experiencing these life challenges, to be able to safely isolate. And so that can also result in further spread within communities. So that kind of gives you an overview of what we're seeing in terms of the spread. And so coming back to your question around the contact tracing process, so whenever a case is identified, so somebody tests positive, public health teams within 24 hours of getting that lab result, and in the north, we're actually sticking very much to that time frame. Then we get a hold of the person, and then we start this interview to try and, one, find out where they would have gotten exposed, and then secondly, to try and elicit people who would have been who would have come into close contact with this person while they were infectious, because we want to make sure that they're isolated so that there isn't further spread of the disease within the community. And on average, in the north, it varies in terms of the average number of contacts that people have as part of the contact traces. It could just be anywhere from a handful, but sometimes we see people, who live in a house, there's 10 of them, so you can get 9 contacts, close contacts, or you can even have more if you've attended a large gathering, so people ending up with something like 15 or 20 contacts even. So that's not unusual for us to see and encounter that in the north. And for us to complete the contact tracing process, it actually takes a long time, depending on the situation. If it's a straightforward case, and somebody has, 2 or 3 close contacts, then it doesn't take that long. We can wrap it up in about an hour. But again, it's a very detailed interview and rigorous process, because we want to make sure that we're being thorough and aren't missing anything. And we use standardized tools, so it doesn't matter who's doing the investigation. If I'm doing it, or one of my nursing team is doing it, or somebody else who's been brought in to assist with it, we're all eliciting the same information in a standardized way. If we have large or complex outbreaks or exposures that impact, public facilities or schools or other types of businesses, then it can even take longer. It can take several hours to get this information. We're sometimes having to go back and get more information, and so it can be quite challenging and can even take up to several days if needed, if we're needing to go back and gather additional information. The other part I think that's important to highlight in terms of the time that it takes and capacity around contact tracing is because sometimes there's specific challenges in the north that maybe other areas won't necessarily encounter as frequently. Sometimes having to reach people who don't have phones is a challenge and can take time. Sometimes, when we follow up with people, because we do monitor people as well afterwards while they're in isolation. If people don't have phones and it requires a home visit, that's extra time and capacity. There's also, a lot of work that occurs in the background in terms of coordinating specific supports that people may need, whether it's, social supports, food supports, cleaning supplies, those types of things. But also, a lot of communication that needs to occur, a lot of entering of this information in our official databases so that it can be captured accurately, because this is what feeds all of the systems that then end up counting this data accurately and presenting it in a meaningful way. So it's a very complex and time-consuming process that requires a lot of teamwork, Brandon.
Yeah, so thank you for that very detailed reply. I'm beginning to get a picture now of why we can't simply outsource this. I think it was CTV. I saw something read about it as almost an art, and that's what makes it difficult. Anything that touches health, it needs to have a degree of security and conscientiousness about these details, right? Confidentiality and stuff like that.
Absolutely.
With this big undertaking, in December, it was said that the SHA was going to repurpose about 600 staff to, kind of assist the public health nurses and maybe pick up some of not the initial calls, but the follow-up calls and stuff like that to help deal with this workload. So how is that going, and have we thought of any other creative solutions to this backlog?
Yeah, and so I can speak again, Brandon, to what we're doing in the north and some of the additional supports that we've enlisted to help us. As you said, obviously this required quite a bit of training, and obviously the more people do it, the more comfortable they get with it. Our public health nurses right now are very experienced in this type of work, and the advantage actually of having people who live and work in the north do this type of process is that they know their communities. They're familiar with people. They have existing relationships. There's trust that's already there. That certainly helps to facilitate these complex conversations and processes. So as much as we're able to, all of that work is done locally, but we are able as well to call out for additional supports, and this can be done remotely to help with the case investigations, the contact tracing interviews, the notification of test results when somebody's been tested and have tested negative or positive, as well as the follow-up that I mentioned is done as well for active cases and close contacts who are under isolation. So some of that is extended out remotely, particularly for situations where it's pretty straightforward. We can reach people by phone, and people are aware, and then they're followed up by the same person throughout that whole process. So regardless of where they are, you've sort of established this relationship over the phone, and so it works pretty well. But there are these exceptional situations that we encounter frequently, I guess, in the north, where we do need people who know. Who can be able to help us find people, that aren't as reachable, for example, by phone. So I think we're in the north. We're really trying to access these additional resources as the province makes them available. But I think the challenge too, Brandon, that's important to highlight here is that it's not just the north that's experiencing a huge workload rate. So it's difficult sometimes, to ask people to help. When they're also experiencing a lot of activity. I think we do a good work in terms of trying to share the workload. When we were experiencing a bit of a lesser workload, then we were able to help other regions as well. And so right now, when people are able to help us as well, we're certainly reaching out for that help. And there's processes in place for coordinating these types of requests that are then able to be put in place very quickly. So I think we've really benefited from that help as well, and we've also helped out others. So it's all about teamwork.
Really quickly, can we talk about the UK variant? That is, just to be technical, B.1.1.7 out of the United Kingdom. I don't think there's much of it in Canada, if any, in Saskatchewan, but that is definitely something that's on a lot of the public's mind, as this is showing increased transmissibility, somewhere or maybe even more, up to 50% more kind of contagious or spreadable. So given that this conversation is in part about keeping up with contact tracing, are we at all worried about that new variant, or is that on the radar for how we would deal with that?
Yeah, another good hot topic right now, Brendan, as you rightly say. So this is something that we're keeping a really close eye on in the public health world. It's not just the UK variant, but other emerging variants. We've heard as well about the South African one, as well as now more recently, there's one identified out of Brazil. So we're really keeping a close eye on that. And you're correct in that in Saskatchewan, up to today, we have not detected either any of those variants right now. This, I just wanted to mention something too, because it's not surprising that there's a variant. Those of us who work in public health know that these viruses constantly change, right, through these varying levels of mutations. And sometimes these mutations stick around, sometimes they don't. And so it's not surprising that this specific virus as well has now seen these types of variations. And you rightly said that what we've seen so far is that particularly with this UK one, it's seen that it's more easily spread and more quickly spread than the other than the kind of the original virus that doesn't have this variation. But what we haven't seen is any increase in severe illness or in the risk of death. So it's really thought to be just more easily transmittable and more quickly transmittable, which means, we still need to be vigilant because then, we don't want to be, if we start getting hit with it, we don't want to see an increase on our healthcare system beyond what we're actually seeing right now. So the more we can do to try and maintain all of the measures that we're doing now to avoid getting to that point, that would be great. And I think you probably know that in Saskatchewan, we're already keeping an eye out for this through our provincial lab. And then if we do have the ability to, through our lab, then forward it to for further genomic sequencing if we think there's a potential for this variant to be around. Sorry.
Just a little note about it is well known, I guess, now that these variants are more contagious, but they're not more severe. And that is a very important distinction. I guess the issue there is that severity scales linearly and contagions, that is something that can scale logarithmically. So it is very much a function of compliance, and that's why we're talking today to implore people to still hold strong and follow the public health orders, because these case numbers and the contact tracing is very much a function of compliance, and we want to keep that R value down. So before I lose the rest of my time with you, I just want to pivot to vaccinations. How are things going? It's so amazing to see vaccines entering the far north and far northeast where I live.
Yeah, no, it's been an exciting time for us too. As you rightly said, we started rolling out the vaccine across the north not too long ago. It's been an exciting time and a very welcome opportunity for all of us in the north to have this additional tool that's going to help us get an additional layer of protection against COVID-19. And so I think we're off to a good start in the north in terms of how we've been able to, within a relatively short time frame, put processes in place through a lot of logistical work. A lot of things had to be in place in terms of transportation, training, healthcare workers, coordinating, getting the people who are eligible in this first phase in terms of high priority. All of those people to be able to receive their doses in a timely way. So I think we've done a really good job in terms of that. There's still a lot more work. Obviously, this is a phased process, starting with the highest risk populations, including our long-term care residents, as well as staff working in the front line who are at highest risk. And then working down through those age groups, starting with our elderly population, and then working our way there. And right now, making plans in preparation for additional arrival of vaccine. Obviously, this will be happening in a phased approach, so we constantly have to be ready for it. So a lot of teamwork, but I think excellent work in the north in terms of that process, but also in terms of the uptake that we have seen. We've seen some people decline the vaccine, but for the most part, we're really off to a good start in terms of the uptake.
Thank you for that detailed answer again, Dr. Khaketla. The last question I have for you just appeals to, I guess, your personal history. In preparation for this interview, I did a little bit of Google sleuthing and found some previous publications and good work that you had done. And part of that was around HIV/AIDS in the province and dispelling myths and certain conceptions about the transmission and safety around that virus. So given that we're dealing with another virus and you're taking that knowledge into it, have you had to deal with much myths or vaccine hesitancy around COVID? Because I know our health minister had said on the 6th of this month, or seemed to imply that there was some hesitancy around Moderna.
Mm-hmm. Yeah, thank you. Brandon, vaccines are one of my favorite topics as a public health physician because we've been dealing with vaccines. They're excellent, and they have really been a game changer in the world of public health in terms of prevention of disease. So with this COVID-19 vaccine, fortunately, we've got all this experience. So it was easy to translate that into the rollout of this specific vaccine. When you talk about the myths that are out there, it does concern me quite a bit, not just as a physician, but also as a northern resident, because it's very dangerous because it adds this kind of unnecessary fear and anxiety for people, and it scares people from getting what we know to be safe and effective and life-saving vaccines. And so, I think there's a lot of work that we still need to do to ensure that people have the correct information around these vaccines. And I also just wanted to highlight maybe some key issues related to the specific vaccine that we are receiving in the north. For all of the vaccines that we've received in the far north area within my coverage area is the Moderna vaccine, which is an mRNA vaccine. It's safe. It's approved by Health Canada, and we know that it has the ability to prevent illness, as clearly demonstrated through the clinical trials that have been conducted that involved large numbers of people. And given that they have gone through, the rigorous approval process that exists within our country, we have full confidence in the world of public health that this vaccine is safe for people to receive, including for all of us in the north. It's pretty simple too, because it's like getting a flu shot, right? But you still need your 2 doses in order to get your 90 plus percentage protection that has been well established. And so it has, like any other medication that you may take, some people can experience mild side effects, headache, or, pain at the injection site. And that's kind of what we're seeing when people receive it. Sometimes people can get, a fever, perhaps, because this is kind of part of the process of your body building the immune response. So it's not unexpected, and then they go away. And the other thing too, I think that's important that I want to dispel. You get these people that go on social media and they're putting out information like, this vaccine was developed too quickly, so it's not safe, which is absolutely not correct. The same rigor that goes into development of other vaccines have gone into these specific ones as well. We just had the fortune, I think, in terms of the timing, all the increase in terms of dedicated funding, the technology that was available, the international collaboration amongst various scientists and health professionals and researchers and industry and governments that enabled us to be able to move at such a quick pace. Plus, we had already learned about other viruses, including the initial SARS and Middle East respiratory syndrome. All those things that helped inform this fast pace. But no corners were cut in development of this vaccine. I think people, if they read credible information around the development process, the approval process, the clinical trials, they will have the same level of confidence that we as public health experts have around that same process. And the other thing too that I want to dispel, because I've heard a bit of it going around too, is that these vaccines can change your DNA, or that they can introduce COVID-19 into your system, which is both of which are completely false, because the vaccines do not contain any live or dead virus. It's just a way of teaching your body how to build an immune response and to be able to recognize the COVID-19 virus when it is exposed to it. So absolutely no truth to that at all. And then the other one that I've heard, which is also completely false, is that it's not safe until we get more data. I mean, if you look at the thousands of people that have been enrolled in these trials that have gone through this process, I think there's no question about the safety. I think what we're looking at now is kind of just following up to see, how long this immunity is able to last, because we haven't had enough time to be able to make that judgment. But so far, I would encourage that people look. If you go to the Government of Saskatchewan website, there's actually a specific page that's dedicated to vaccines for COVID-19. So there's really good information there that's presented in a way that people can easily understand it. Health Canada also has reliable information that people can look at there to help inform themselves. And I hope that when it's, when people get their turn to get the vaccine, that they will definitely roll up their sleeves so that they're protected, because the more all of us are protected in the north, we achieve that level of what we call herd immunity amongst a large proportion of our population, then the better protected we all can be.
Nice. Yeah, I don't know where that little bit of conspiratorial thought comes from, possibly from past vaccines, maybe being based around like I studied biology, so the retrovirus concept where you're actually putting genes back into DNA, but this is not that. This is a whole new system, an mRNA vaccine, and it's already being applied to other diseases. I read yesterday that mRNA tech is being applied to multiple sclerosis and may be developing a cure already. So this is revolutionary stuff that we don't need to be afraid of. And you've done such an eloquent job explaining why that is. Thank you for all your time today, Medical Health Officer Dr. Khaketla. And I feel very much it's an honor and a privilege to be able to talk to you and give a little bit of clarity for our northern citizens.
Oh, Brandon, I am so grateful to have had the opportunity to connect with you and the NBC listeners today. It's always a pleasure and a privilege for me to be on NBC. I just wanted to leave a few key points to your listeners this afternoon. Again, I want to emphasize that, we're at a critical time at this point in the pandemic. You mentioned, earlier on, we've gone through HIV and AIDS, impacting our northern communities. We now have a chance, I think, in the north to change the course of this disease across our communities, but we all have to do our part to ensure that we get there. And again, going back to the basics, I can't emphasize enough, stay home if you're sick, get tested. Please don't be afraid to get tested. Avoid gatherings, avoid non-essential travel. Let's keep physically distant. Let's keep wearing our masks. Let's keep washing our hands. And again, the final point being, when it's your turn to get that vaccine, I hope we will all take that opportunity and get the COVID-19 vaccine. It's a challenging time for us in the north. Let's look out for each other. Let's be kind to one another. COVID-19 is affecting all of us in different ways. The more we can pull together and fight this together, the better chance of success we have of getting through this pandemic. Thank you, Brandon.
Thank you.